let me tell you about me. So this is me. That's me. I am Dr. Bella Smith, so I'm a GP, and I am a GP in Woodbridge. I qualified from Nottingham University in 2002, so about 17 years ago, I think. I left med school with 2 degrees, so I had my medical degree, but I also had a biomedical sciences degree in first class. And I moved to London, and in those years were my junior doctor years, a bit of a blur, to be honest. They were mostly nights, mostly weekends, really long hours, and shed loads of exams. And by the time I was in my early 30s, I was a member of the Royal College of Physicians, a member of the Royal College of GPs. I was a fully fledged GP and a mum. And I moved up to Suffolk here 5 or so years ago from London. In general practice, we all have our areas of interest. Mine are women's health, so I do all the coils, the implants, the contraception, the menopause, the gynae. I have an interest in skin, so I do dermatology, I do dermoscopy, so I look at moles with my dermatoscope to see if there's skin cancer. I do minor surgery, I do aesthetics, so I've worked for 5 years in London in a company called Cosmetics doing fillers, Botox, etc. And I now work at the Nuffield on a Wednesday morning doing Botox for sweating, facial wrinkles and for red veins. I set up something called the Digital GP, which I showed you at the beginning. Digital GP, it was like an online platform really for my patients. Initially it was really for my patients to communicate, because I find sometimes I say the same thing. I have a pattern of things that I say, like for example the Marina coil. Women want to know about the Marina coil quite rightly because it's brilliant. But I would say the same thing again, and often I say to women, well, look, why don't I record a video of me talking about the Marina coil, then you can have a listen to it and look at it in your own time and then come back and have a chat with me. But it's taken me, the Digital GP has gone further than I thought, and it's led me to become a GP advisor for the Eva Peel charity in London. I've been on, I've been on BBC Women's Hour, Sky News, Channel 4, and I've just signed with a TV agent. So who knows what the future holds. But right now I'm doing public speaking, which is fantastic. So that's me. Okay, now let's go on to this talk. So the menopause. The thing I feel about women's health, I feel really passionate about women's health, because I feel as women, we are kind of stretched in every direction. So we are expected, and I think we put pressure on ourselves, but I think also we have pressure put on us as well. We have often very successful careers, we're often mothers, often partners, we're often looking after children, school admin. I mean, school admin, oh my God, school admin is a nightmare. And then also parents, our parents are going to get elderly and they go from being independent to being dependent, and that's a real issue. So we have very little time for ourselves, and I think that can be a big problem, and we often put ourselves last, and our health can be put last. And the thing with the menopause is it's such a grey area. It's a very personal journey. There's no, you're going to do this, you're going to do that. It's this might do this, it might do that, you just don't know. And therefore, it's easy to, it can be subtle, so it's easy to sort of normalise or to ignore or to just put up with, which is a shame. Also, there is a bit of a stigma with the menopause, so whether it's to do with embarrassment or whether it's to do with some of the symptoms or the side effects, or whether it's the fact that actually it marks the end of youth and more into, you know, it's difficult to say why, but some women find it very hard to talk about. There's lots that we can do to reassure, lots we can do to self-help, and it's all about raising awareness and education and talking. So, a few questions. I always hate it when you're having a talk and then they turn the questions on you, but I'm going to try and see if anyone knows. Does anyone know exactly what the menopause is?
The body's shutting down from being fertile.
Exactly. So basically the ovaries stop functioning, the periods stop, and your fertile years come to an end. That's exactly it. Anyone know how old we will be when we go through it?
It can vary usually from very young to quite old.
Exactly. The average age in the UK is 52, but any time from 40 upwards is normal. If it's before 40, it's a premature menopause. Does anyone know how long it can last for? Too long. Yeah, exactly. So you have 2 women. One lady may stop her periods, have no symptoms, she sails through it, no problem at all. Another lady may suffer for a decade with the worst symptoms in the world. I mean, it's literally that different. Do you know how we diagnose it?
A year from having had your last period.
Right. Right, exactly right. So we can say when you're postmenopausal, we can say very easily when you've been through it, because we say if you're over 50 and you haven't had a period for a year, you're postmenopausal. If you're over 45 and you haven't had one for 2 years, you're postmenopausal. And that's kind of quite easy. What we find difficult is the perimenopausal years. So the perimenopause is basically a roller coaster where your hormones are going up and down. And if I did a blood test, it would just show me that you're having periods still, which you would be because you weren't postmenopausal. It really wouldn't help at all. So perimenopause is very much a clinical diagnosis on, just like I did with Mary, you take a history, you exclude everything else, right age, right kind of symptoms, that's what it is. Sometimes what you can do is do a trial of hormones, because what hormones do, you do it say for 3 months. If you go back, if I gave Mary 3 months of hormones and she went absolutely back to normal, that's our diagnosis. We know it's menopause. She doesn't have to stay on the hormones, but at least she knows that it's not Alzheimer's or not dementia. Okay, yeah, sip of water. Right, shout out, who knows some symptoms? Right. Okay, are you ready for this? So hot flushes, whoever said hot flushes, 85% of women have hot flushes. Hot flushes. Okay. Night sweats, irregular periods, reduced libido, vaginal dryness, mood swings. These are all classic menopause symptoms. But there are also other symptoms that can come as well. Sleeping, so tiredness, hair loss, sleeping problems, memory problems, dizziness, weight gain, urinary incontinence, allergy. Allergy is a big one. I see a lot of women who suddenly become allergic. Dry nails, palpitations, depression, irritability. Breast tenderness, migraines, joint pain, dental problems, muscle tension. And that's, I mean, look at that. So you can see why it's a complete sort of, it can be a nightmare for some women, absolutely. Okay. Another thing I want to say is, if, 100 years ago, women, we were living till we were kind of 60. We were postmenopausal for 5-10 years. Now we're all going to live till we're 100, so we're going to be postmenopausal for half of our lives, nearly. And actually, up until you're menopausal, you have estrogen that protects you. It protects our bones, it protects all our tissues and our joints. It protects us more than men who don't have estrogen, against things like heart disease and stroke. As soon as you go through the menopause and your estrogen depletes and goes down low, your risk of things as time goes on, of things like fractures from bone thinning, osteoporosis, heart disease and stroke goes up. Well, there's also this condition called the genitourinary syndrome of the menopause. Now, I'm actually going to talk about this at the end in a bit more detail, but this is an incredibly common, undiagnosed condition. So 50% of women at about 4 years after the menopause will get changes to their vulva, vagina and their urinary tract due to lack of estrogen. And this causes all sorts of symptoms. And only 10% of women are actually being treated with the right medication. So this is something that's really unknown and yet so common. And it leads you to recurrent urinary tract infections. So I will talk about that in a bit more detail, about what you can have, because it's easily treated. So these are all the risks long term after the menopause. Right, so let's talk about management. So if you think about, say, any disease, any problems, if we can sort our lifestyle out first, then actually often that's enough. So we know that exercise protects us from most cancers, heart disease, stroke, obesity, diabetes, dementia. So if we are exercising regularly, then actually that will really help most diseases and the menopause. So it's so important that we look at and we talk about lifestyle. And obviously we're not expecting people to be super duper fit, but it's little tweaks here and there that we can make to make sure that our lifestyle is as good as it can be. So lifestyle, diet, exercise. As I said before, there's hormonal treatment, there's the non-hormonal treatment, there's the supplements that you can buy over the counter, lots of them that you buy. You go into the health food shop, you go, which ones do I take? What can I have? And then there's the talking and behavioural therapies. So Exercise. I'm going to tell you a bit more about exercise. So we should be, according to NICE guidance, we should be doing more than 150 minutes of moderate intensity exercise every week. And that's to maintain good health and prevent all those other things I was telling you about. So that's anything where you feel slightly out of breath, slightly sweaty. We should be doing things like Pilates and yoga. We should be doing strength training. So we don't want to build weights, but as we age, our muscle mass will deplete. So actually doing the odd bit of weight training will maintain that muscle mass, which helps you not gain weight after the menopause, keeps you strong, keeps you active. Also, weight-bearing exercises. So if you do exercise that you're jumping up and down on your feet, running, power walking, dancing, aerobics, that will help strengthen your bones and keep them strong after the menopause. Other things in your diet, hot flushes. If you reduce the alcohol and the caffeine in your diet, that can help hot flushes. Reduce or stop smoking, really beneficial to your symptoms. Maintaining a healthy body weight. Again, this is a lot to do with diet and exercise. And the dietary changes, I always say, have a rainbow of veg. Okay, if you think about every single colour in a salad or veg, or in a bowl of vegetables, every single colour represents a vitamin or a nutrient or a mineral. If you have an absolute variety of colours, you're going to have a brilliant variety of all the goodness, together with all the vitamins and the fibre and the things that will keep you healthy. Plus they're low in calories. So it's just a case of planning and creating these little bits of vegetables and food that will help, and they can then help your symptoms and keep your weight down. The Japanese diet is really good for menopausal symptoms. So fish, especially salmon, has been found to be great for hot flushes. Soya, so soya can be in tofu, soya milk, soya cheese. You can get so many different products now. They have natural phytoestrogens, so natural estrogens within them that will help with your low estrogen that you're getting from the menopause. Soy, as in soy sauce, they've got isoflavones in, again, which are really good. And flaxseed, so you can get these kind of packets of flaxseed that you sprinkle on your yogurt, and they're, again, I've got patients who swear that they help their hot flushes. Relaxation exercises. So first of all, we're all so busy, so often it's good to just, in fact, even if you're not menopausal, it's so good to have a way of relaxing and de-stressing and empty our heads from all the stress of the world. Doing things like mindfulness, meditation are all brilliant. Also, if you're having hot flushes, sometimes you find that you get this panic that comes on because you think, I'm getting a hot flush, everyone can see it, oh my god, and before you know it, it's actually exacerbated it. And actually, if you can relax and learn to do breathing exercises and breathe through it, there's evidence that it actually reduces the severity of the hot flushes. So it's certainly something to think about. Sleep hygiene. So sleep is, I could literally talk for hours about sleeping. Sleep is the most important thing that we can do, and yet none of us have enough sleep. And I think it's a combination of lifestyle. It's to do with having screens, having too much caffeine, having too much alcohol, the white light in our rooms, artificial lighting. It's a combination of things. And if you can sort your sleep habit out, so making sure that you exercise so that you're tired, so you sleep well, having a pattern, a habit where your body knows when to go to sleep, making sure the conditions you sleep in are optimal for sleeping, so quiet, dark rooms that aren't no noise, without your light, without your phone, without a TV, then you will probably sleep better, and then you feel more motivated in the morning to do whatever you need to do. Often this is a cycle though. You've kind of got to get your symptoms right before you can sleep, but it's all together in the melting pot. And then finally, it's keep hydrated. So again, after the during or after menopause, things will start to dry slightly. Skin, hair, joints, even the vertebral discs. And if you keep hydrated and drink plenty of fluid, it keeps it nice and hydrated and healthy. Any questions so far? It's all a lot of information, a lot of chat.